impact. Well, now, a bereavement fund has been set up to help families of victims in collaboration with the Ubele Initiative, a London-based social enterprise who are calling for a public inquiry into why this is. Well, Yvonne Field from the Ubele Initiative joins me now. Yvonne, thank you for joining me this evening. First of all, just tell me more about this fund that's been set up to help grieving families. How did it come about?
So one of the lessons that we learned from Grenfell is that there's a need for targeted, culturally sensitive mental health and bereavement services. And we have a lot of clinicians and therapists from within BAME communities who were not able to offer services to our communities when Grenfell happened. So the idea was to set up a fund where we could actually identify clinicians and therapists and actually match them with families who need bereavement support. It's also for support around memorials, because often we found within this situation that obviously in terms of burying the dead, many people couldn't be there, and there'll be need for memorials next year and later on this year. So we set the fund up through GoFundMe in order to have this opportunity to support people from within our communities.
And Yvonne, we know, all the figures suggest at least, that people from BME backgrounds are disproportionately affected by this coronavirus. Why do you think it is? I mean, we're seeing it here in the capital, here in the UK, but also overseas.
Yeah, as you say, I mean, the figures are quite shocking, and there are a whole raft of reasons, and there isn't just one in particular. I mean, I think the government has particular perspectives on, for example, sort of trans living conditions and etc. But actually, those of us who are involved in frontline services and working with communities know that there's been systematic exclusion, discrimination. There are huge equality issues. And in terms of some of the health outcomes of our communities, they are very poor. So I think it's a raft of reasons. The net result is what we've ended up with now, in terms of disproportionate numbers of people from BAME communities actually being infected and dying. I have personal experience within my family. We haven't had a death, but we have had at least one member of my family very sick indeed and in hospital. We need to look at this, and that's also why I started a petition 2 weeks ago asking for a public independent inquiry. Just after I launched the petition, the government announced a review, but as far as we're concerned, that's not good enough. We actually want something that really gets to the root of branch of what's happened, and we think that an inquiry will allow that to happen, and that review will be fairly superficial and actually not ask the deep and searching questions that we need to have answered.
Okay, Yvonne Field from the Ubele Initiative, thank you very much for talking to me this evening. Thank you.
Thank you very much.